Valley fever, the silent outbreak spreading across the American Southwest. Point 1. Introduction. A red flag from California. In the first quarter of 2025, California reported 3,123 cases of valley fever, the highest number ever recorded for this period, and nearly double the 10-year average. This alarming rise follows a record-breaking year in 2024 with 12,637 total cases statewide. Experts now warn that 2025 may surpass even that. But what exactly is valley fever? Why is it emerging as a serious public health concern in the United States? 2. What is valley fever? Valley fever, medically known as coccidioidomyces, is an infection caused by inhaling spores of the fungus coccidioides, which lives in dry, dusty soil primarily in the southwestern United States. When the ground is disturbed by construction, wind, or wildfires, these spores can become airborne and easily inhaled. Many people experience mild or no symptoms, but in some cases, it can lead to serious illness, such as pneumonia or even meningitis. 3. Why is it spreading more now? Several environmental factors are fueling this surge. Rain gives fungal growth, gives drought, gives airborne spores. Wildfires and dust storms are becoming more frequent. Urban development and construction disturb infected soil. These changes create the perfect storm for spores to spread and infect more people. 4. Who is most at risk? Certain individuals are more vulnerable to infection and complications. People with weakened immune systems, HIV/AIDS, cancer treatment, transplants, pregnant women, especially in the third trimester, elderly individuals, people with diabetes or chronic health conditions, outdoor workers, construction crews, farmers, firefighters, archaeologists. 5. Symptoms and progression. Symptoms usually appear 1 to 3 weeks after exposure and can mimic the flu: fever, cough, chest pain, fatigue, shortness of breath, headache, muscle or joint pain, skin rash. In most cases, the infection clears up on its own. However, if left untreated, it may spread to the brain, bones, or skin, causing long-term complications or even death. 6. Diagnosis and treatment. Diagnosis involves blood tests, chest x-rays or CT scans, tissue biopsy in complicated cases. Treatment options include fluconazole and itraconazole, common and TIF. Fungal medications. AMPHOT or ICINB for severe disseminated infections. Treatment can last from a few months to over a year, depending on severity and response to medication. 7. How to protect yourself. While it's nearly impossible to avoid exposure entirely in endemic areas, you can reduce your risk. Avoid outdoor activities during dust storms or high winds. Wear masks when working with soil. Wet soil before digging or construction. Use indoor air filters to reduce airborne particles. Monitor pets, especially dogs, which are also susceptible to infection. 8. A public health challenge. The rising number of valley fever cases poses serious challenges. It is often misdiagnosed as flu, COVID-19, or pneumonia. Public and even medical awareness is low in many regions. Lack of accurate data. Canine infections suggest wider spread than official numbers show. Urgent need for better diagnostics, education, and research into vaccine development. 8. A public health challenge. The rising number of valley fever cases poses serious challenges. It is often misdiagnosed as flu, COVID-19, or pneumonia. 9. Final message: be aware, stay safe. Valley fever is no longer a rare disease. It's becoming a growing threat, especially in arid parts of the American Southwest. Climate change, construction, and shifting weather patterns are likely to make things worse in the coming years. By staying informed, recognizing early symptoms, and taking simple precautions, you can protect yourself and your loved ones from this invisible yet dangerous infection. Thank you for watching today's video. If you found this information helpful, please like, share, and subscribe to our channel for weekly health updates and tips. And don't forget to turn on the notification bell so you never miss a new video. Stay safe, stay healthy, and see you in the next episode.